Hello everyone, Nunzio Zotti here. I'm a medical resident in public health in the University of Pisa and I'm EUPHA Fellow for the APH conference here in Lisbon. Today we are pleased to have a chat with Stefania Boccia, which is a full professor at the Catholic University of Rome, and to date she is the president of the Public Health Epidemiology at EUPHA. Would you please tell us what is done in your Public Health Epidemiology section and what updates there are?
Thank you, Nunzio, and thanks to EUPHA Next for giving the chance to explain what is Public Health Epidemiology section about. So the section has been established 30 years ago. It is the oldest section of EUPHA, and it has more than 6,000 members. It has been very active. I have to say that in the past years, also all the workshops and abstracts that we submitted have been accepted. Why? Because I think that epidemiology and the methodology of epidemiology are the backbone of public health professionals, and there's such a demand to discuss not only about the methods, but how much use a strong methodology in epidemiology can really provide a strong evidence base for public health practice. And today is a special day for me because I am exiting this incredible, 6 years of activity. So, and I did hand over to Angelo Pizzullo, who has been democratically elected as the new president, and he will be served also from two incredibly high curricular level professors as vice presidents from two important universities in Europe. So I'm sure there will be a number of activities done in the future. And maybe you want me to say something about the Congress or something else, Nunzio?
Okay, so the second question is, how's the PH conference going for your section and what are your take-home messages?
Yes, okay, so basically we had a number of different activities. The first day we organized a pre-conference skill on how to write an effective academic publication in public health. It was quite well attended, and then the day after we had two workshops. One was organized with the health impact assessment section, and it was discussed how the methodology, the right epidemiological tool should really be acknowledged and used when it comes to evaluating public policy. Unfortunately, this is not always the case. It's not easy, it's not straightforward understanding which tool you have to use when evaluating the impact of a certain policy. And then in the afternoon yesterday we discussed instead of a completely different topic, public health genomics, so how epidemiology can be useful in order to gather the data to be used for make prevention be more personalized. A completely different topic. It was co-organized with the public health genomics section of EUPHA. While today we spoke about a very relevant topic for public health, which is vaccine hesitancy. It was so crowded the room, and I think we made a good work. We represented to an extent some European countries. Very limited uptake of vaccination of COVID-19, and we understood also which were the determinants, so low socioeconomic level, but in some other countries it was opposite. So I think understanding the different realities of the different countries using the right survey, the right source of data are fundamental. And so the future is in the hand of Angelo, but also me. I'm the steering committee. I'm continuing to serve the section, and not only with other people with me, and we want to for the next year but also for the future year give really the fundamental knowledge of epidemiology to all the public health professionals. And I please ask you to sign the section list, because if you are active member then you can suggest us which workshop to submit, which also practical tools you really need to have, because something emerged today also about how to peer review a paper. People doesn't know exactly what they have to spot when reviewing a paper, and you have to have some knowledge in epidemiology, how to design a study. So I think that our section is so active and we want you to be a member. Thank you.
Thank you a lot for your time and your thoughtfulness. So that's it.